please. Thank you, Sandra. Thank you, Mr. Imam. Dr. Hafsa, are you there?
Yes, I'm there. Just failing to get there.
Perfect. Thank you.
Yes.
Okay, so if you can mute just while we get started, and then we'll ask you to unmute when it's time for your presentation. Okay, Ellie, I think we can get started. Hello, everyone. Thank you for joining and welcome. We'll just wait a minute or two for people to join. Thank you. Good morning, good afternoon, good evening, everyone. Thank you for joining. Just waiting another minute for some more people to join. Thank you. Okay, I think we can get started. Good afternoon, good evening, and good morning to everyone. Welcome to the Union's webinar for the Global Implementation Hub, focusing on enforcement best practices for effective implementation of tobacco control laws. I'm going to hand over to my colleague Ellie for some housekeeping. Thanks, Ellie.
Hi, everyone. So today we will be having interpretation. So presenters, some will be speaking in English and some will be speaking in their native languages. In order to access the interpretation, there's a little globe at the bottom, and you can click that globe and then select your language of choice. It's pretty easy. So translators will translate into that language when you're on that channel. And for presentations given in other languages other than English, that will be translated into English, and then another translator will translate the English into another language. So you should have access to and understand everything that's happening, which is fantastic. And we'll also be having a Q&A panel at the end. So there's a Q&A box also at the bottom. The chat is disabled for this webinar, but the Q&A is open. So if you have any questions, please send to the Q&A function, and we will answer as many as possible at the end of the webinar. And with that, I pass it back over to Kathy to get us started. Thank you.
Thank you. Thanks, Ellie. I will share my screen. Can you see that?
Yep.
Wonderful.
Lisa.
So thank you, everyone, for joining us. My name is Kathy Wright. I am the Senior Program Manager for the Union's Tobacco Control Implementation Program. I would like to start by thanking you all for joining us today for our webinar on implementation, best practices and lessons learned. Today, we're aiming to share experiences and best practices of achieving high compliance with tobacco control laws, showcase practices which have led to sustainable implementation over time, demonstrate some of the challenges that have been faced and the lessons learned with adopting and implementing tobacco control laws in different countries, with a particular focus on cities, and also to explore some free resources which are available in the Union's Global Implementation Hub for supporting other cities and countries around the world to effectively implement their laws. But first, I'm going to give a very quick overview of our topic before I introduce our speakers. So, to start with, why should we be focusing on strengthening implementation and enforcement? Many countries have made great progress in tobacco control in recent years by adopting strong policies recommended by the World Health Organization's Framework Convention on Tobacco Control. Yet ineffective implementation of policies can lead to unsustainable and poor compliance rates. So over 4.5 billion people, that's 63% of the world's population, are covered by at least one comprehensive tobacco control measure. But more progress is needed in effective implementation to improve compliance, protect the population, and avoid risking the policy being turned back. More than 1/5 of the parties to the WHO's Framework Convention on Tobacco Control.
Il faut aussi noter que plus de 1/5 des parties considèrent que l'application de la loi
pela extensão da implementação e aplicação
kondisi yang berkaitan dengan kepatuhan untuk bisa memahami situasi yang
strong policies do not automatically equal strong compliance, and without the strong compliance, people are not protected. So very briefly, law implementation overview. You can see we're focusing on this stage after the legislation and regulations have been passed, which include communications and social mobilization, business compliance building, enforcement, and monitoring and evaluation, which include building of voluntary compliance, as well as monitoring compliance and responding to non-compliance, to violations. Today, we will be looking a little bit more at the enforcement side, but implementation as a whole as well. So a few examples of some of the key elements of effective enforcement systems include resources, for example, budget for tobacco control implementation and enforcement, strategic plans and with resources allocated for relevant actions, ministries that are conducting routine monitoring and responding to non-compliance, and funds include health levies, tobacco taxes, licensing fees, fines, etc. For management, really we're looking at a whole of government approach, so a functioning interagency coordination mechanism, which is led by the city government leadership, having strategic direction that's understood by all relevant stakeholders, performance management of enforcement officers, as well as of departments that are responsible for implementing the law, and also conducting research to understand the impact that is being had by implementation actions. So for people, we're referring to officers being fully trained in all aspects of enforcement of tobacco control laws, regular capacity building and refreshers, and stakeholders in all relevant areas, from senior leaders to inspectors to civil society to the judiciary, are all well sensitized and know their role under the law. And finally, processes refers to standard procedures for operations, reporting requirements, appropriate forms and checklists, good practice of inspections, as well as monitoring and evaluating those processes. Now, you will get to hear more about these different elements through the case studies that we're presenting. And I'm going to now introduce our panel and our speakers. So first, we will be hearing from Mr. Imam Budi Hartono, who is the Vice Mayor of Depok City in Indonesia. We'll then be hearing from Dr. Hafsa Lekwata Sintongo, who is the Assistant Commissioner of Mental Health and Control of Substance Use in Kampala, and Dr. Sandra Marquez, who's the Technical Director of Health at the Reference Center for Alcohol, Tobacco, and Other Drugs in Sao Paulo. This will be followed by a showcase of our implementation hub, and then we will be having a panel discussion. So if I could ask just our presenters to please turn their cameras on so we can see you to start with. There we go, thank you. And please take a look in the chat box where Lindsay is pasting our bios for all of our three excellent speakers. So thank you very much. So I'm going to hand over now to Mr. Imam, the Vice Mayor of Depok City, who will be sharing experiences for implementing tobacco control law in the city in Indonesia. So I'll ask if Dr. Hafsa and Dr. Sandra could please switch off your cameras for now, and we'll hand over to Mr. Imam. Thank you.
Terima kasih, Katie. Selamat pagi, selamat siang, selamat sore, dan selamat malam untuk yang semua hadir di sini, khusus untuk Katie, Ellie,
specifically Kathy, Ellie, and Lindsay. So now allow me, I would like to share with you about the experiences of the Depok City on the implementation of the smoke-free area through the tobacco advertising, promotion, and sponsorship ban. So allow me to introduce myself. My name is Imam Budi Hartono. I am the Vice Mayor of the city of Depok. I'm in Indonesia. So next slide, please. Thank you. Thank you very much to Fela, who has helped me in sharing my slide here. Depok, the city of Depok. I'd like to show you the profile. The population of Depok is...
D'ailleurs, je veux partager avec vous le profil de ma ville. Vous voyez, nous avons une population de 2000.
71,5% dessas pessoas estão na idade produtiva.
A city located close to the capital city of Indonesia, Greater Jakarta, and it has a very strategic position, specifically for the economic development that is happening in the city of Depok. So this is about the smoke-free regulation in Depok. It has been enacted since 2014. And we then decided to renew it again in 2020, which this new regulation includes three things. The first is the expansion of the type of cigarettes included into the ban, which is shisha, vapes, and or other electronic cigarettes. Second is to strengthen the tobacco advertising, promotion, and sponsorship ban, which includes the ban of tobacco product display that in the several point of sales in the stores or grocery stores in Depok. And the third is to strengthening the administrative sanction if there is a violation of the smoke-free area. So this is to show you some of the smoke-free area in the city of Depok. The first type is the public places, and then healthcare facilities, places of worship, children's playground, public transport, education facilities, and workplaces. So these are all area where smoking is prohibited or smoke-free area. Next, please.
Peraturan tentang kawasan tanpa rokok
The regulation on smoke-free in Depok and on the World No Tobacco Day in 2021, the city administration of Depok declared its commitment to implement the smoke-free policy. And second, the implementation of smoke-free policy in which it is the responsibility of the national government, which is derived to the local government, to protect each and everybody's right to a healthy living environment and our rights to access healthcare services. So this is to show you the journey of TAPS ban and also the tobacco product display ban.
beberapa peraturan tahun 2018.
So from 2018, we just had the mayor's regulation. By 2021, we then promote that into a bylaw, which was issued by our mayor in a form of bylaw for smoke-free area. In this bylaw or local regulation, we then expand the ban in the smoke-free area, which includes the ban of showing tobacco products in stores, modern market, supermarkets, and other points of sales. Next, please. Next. Okay. So this is to show you some of the activities that we have done in conducting unannounced and random inspections to 169 modern retailers. As you can see in the picture, the ones who are wearing batik, the one who is wearing batik is the lady from the local government. The ones in brown, they are the bylaw police. And the one in multiple colors, they are the ones who are working as shop attendants in these modern retailers. So as you can see, when there is a display of cigarettes in their stores, we're going to ask the owner of the stores or the personnel of the stores to take down the products. They can only display the word cigarettes are available here or are sold here. This is to prevent the buyers to see the packagings of the cigarettes. And this is to show you how the situation was before the ban was effective and after the ban is effective. As you can see here, there is this word called cigarettes are available and sold here. So when we visited the retailers, they still open up the curtains, but when we visited them for a visit, then they would have to close down the display. Next. So this is another modern retailer that we can see there were some cigarette products that have been changed into other type of products such as formula or other types. Next. And this is the before situation where the store display the cigarettes, which is quite visible for children. And after the raid, they close it down and they only provide with the word cigarettes are sold.
Begitu juga di tempat-tempat terminal, contohnya juga ada
And in terminals as well, there were some areas that used to be when people used to smoke, but we closed them. There are because these areas of smoking are located in the terminals, transportation terminals. So we ban them. And on your right hand side, there are tobacco advertisements. So whenever we found locations with tobacco advertisements, we put them down. And we also performed visits to small shops who sell cigarettes. And we also inform them about the regulations from the city of Depok that there are ban in displaying types of cigarettes in all points of sales in Depok. Next. This one is also very important. This is the compliance rate of this without any with the ban of advertisings, etc. And we can see here, starting from when they perform outdoor ads. This is the light blue bar, and then indoor ads, which is dark blue. The compliance rate for supermarkets and hypermarkets were quite amazing. There are no displays of cigarettes anymore. And this one is the compliance rate before and after. We can see that from 45% in 2019 to 33% in 2021. This is the decrease of outdoor tobacco advertising. And next, this is indoor advertising. The decrease of 57% and also decreasing in the next year. And this one is the percentage of product display, and the compliance is increasing from the decrease display of cigarette advertisement from 95% to 65% in 2021. Next. So you can see here, previously there were tobacco advertisement in the welcoming gate of Depok City, but now it's already replaced by advertisements of other products like foods or other types of advertisement. Ladies and gentlemen, with this tax ban, does it mean that the income of Depok City is decreasing? We can see that from this table from 2011 to 2021, it doesn't have any effect. This tax ban has no impact on Depok City local revenue. It's even increasing from 8 billion rupiahs to now 32.3 trillion rupiahs. We can see we can watch the video now. So on last November 5 and 9, the municipal police of Depok performed monitoring inspections to shops, stalls, mini markets, and also places of worships. The inspections are focusing on places that has the potentials of violating Depok City regulations number 2 about the taps ban. So this is repeating.
Stiker dan tanda larangan merokok. Maaf terganggu videonya.
I'm sorry, there's some trouble with the video. So the stickers and smoking bans are placed in 442 points so that more people can understand about non-smoking area or non-tobacco area in Depok City. Thank you very much. That is all. My presentations to share to all of you. And if you have any comments or questions, my colleague will assist to answer your questions in the Q&A section. Thank you very much and good evening.
Thank you so much, Mr. Imam, for that excellent presentation, and congratulations for the incredible progress that Depok has made. A huge, huge well done. Seeing the compliance rate improve, you know, from by more than half particularly in the convenience stores. Very, very impressive progress. So congratulations to you and to your team for such hard work and dedication.
Terima kasih, sama-sama.
Thank you, you're welcome.
And thank you also for your presentation. I understand that your further commitments will mean you need to leave the webinar now, but thank you to your colleague, Dr. Mary, who will be joining us for the Q&A panel. So if you have questions for Depok, we will be able to get those answered by Dr. Mary. So thank you, Mr. Imam. Next, I'm going to hand over to Dr. Hafsa, who will be sharing experiences from Uganda. So over to you, Dr. Hafsa. Thank you. We can see your screen, but it's not in presenter mode yet. Dr. Hafsa, can you hear us? I don't know, maybe Dr. Hafsa,
Yes,
there you are.
yes, good morning, good afternoon, and good evening, ladies and gentlemen. I hope we are all very well, and as been introduced, my name is Hafsa Lukwata Sentongo. I work with the Ministry of Health in Uganda, and very happy to be part of this team tonight. I think you could share from that side. I think I failed to do it.
Great. I'm sharing, Dr. Hafsa. Please just let me know if you need anything else as I advance through. You're good to go. Thank you.
All right. So yes, next slide. I'm going to share with you an overview of the implementation and enforcement of tobacco smoke-free law in Kampala, capital city, and mainly focusing on the successes and the lessons learned. This is just a picture of the KCCA. This is their logo, and this was the message before that. The message, the tagline, that whatever was being put just a minute before, just to show the previous slide kindly, just a little bit. Yes, the message that we're passing out was, let's make Kampala smoke-free. And this was part of the vital strategies under the Cities for Health. And this was funded through Bloomberg Philanthropies. So by way of background, next slide. By way of background, Uganda is an East African state, and we signed the WHO FCTC, the Framework Convention on Tobacco Control, and we even domesticated it in 2017 through the Tobacco Control Act. And the law is very comprehensive. Actually, we've been told that we have one of the best laws, but the implementation is what we are still struggling with. And I'm happy to share with you what we have started to do with our beautiful law. In as far as the smoke-free is concerned, the law comprehensively bans tobacco smoking in both indoor and outdoor spaces. And for the outdoor spaces, it even goes beyond just the inside of the facility, but it goes beyond 50 meters. You're not supposed to smoke 50 meters away from the boundary of a public place. And a workplace, all workplaces, and also all public transport, facilities. The law goes on to give power to enforcers, including local governments. Kampala is one of the local governments, and other authorized officers to implement the provisions of the Act under the supervision of the National Tobacco Control Committee. We have that national coordination mechanism. It is multi-sectoral. So it is the one that oversees the implementation of this Act in the different jurisdictions. So Kampala Capital City Authority is actually the capital city of the country. And it was mainly formed in 2010 to streamline mainly the operations. There was another, it was being managed in another way, but the authority came in place in 2010 just to streamline operations and to improve service delivery and to just restore good urban governance in the city. So in the authority, the Directorate of Public Health and Environment was the one made responsible for the implementation and enforcement of the Tobacco Control Act. Next. So what are some of the things we've managed to do? So it has been a process, and this particular implementation that I'm reporting came in form of a project mode. And we had, first of all, we needed to set up the teams that would work, that would, spearhead the whole process. So the director of cases, the director of the health, the Directorate of Health was the one under the authority, was the one responsible. So he had a team of people. He had a project manager and other project officers, I think about 5. And on top of that, we needed to identify enforcement teams. It was not easy. Tobacco control was not a department of its own. So it was just something, a unit. There was a tobacco control unit that lacked a lot of equipment, and it lacked a lot of infrastructure. So we needed to work with other people, and so we identified enforcement teams from the noise pollution department and also from the law and order enforcement teams. So once we put together the human resource, then we started off with preparing for the other things that would happen around the project. And this included developing messages, the tobacco control messages. So we made both all print. We had messages under the social media. We had those tags, as I've told you, smoke-free city. There were quite a number of messages that we developed. Then we also made audios and television announcements concerning telling people about the dangers of tobacco, but also the fact that we are trying to make Kampala a tobacco smoke-free city. And then from there, we managed to to engage stakeholders. Of course, you cannot start enforcing without informing the community which you're trying to regulate. So we had quite a number of engagement meetings, and we had community dialogues. We had activation meetings with the business owners and the different transport operations officers. We really went out and told people about the new law that was coming. I mean, the law that we're trying to implement. We also were telling them about the dangers of tobacco, and then the fact that we wanted to make Kampala a smoke-free city. So we also had to train and deploy all the teams. I've told you about those teams. They were doing their other things. You remember noise pollution. They also had to do the enforcement of law and order, people who are selling on the streets and so on. So we needed to orient them now into tobacco control, and we told them exactly what we needed them to do. So the other thing that then we did was to supervising. We went with them. We used to go with the enforcement teams to do the inspections. Then we'll do a bit of compliance monitoring meetings and activities. Then we also had enforcement activities. And then we also had to take whoever we had found guilty of the law into custody or whatever. We had to present them to court. And we ensured that most of these legal issues were actually concluded. But the most important thing also that happened was the destruction of the impounded products. So the next slide is going to show us a few of the pictures, just to show some of the messages, some of the activities. For instance, this very first one, this is the director of Kampala. And this is a television news. It was news, and it was showing that KCCA bans public smoking. So he was being interviewed by the different media. There were quite a lot of media who invited to be part of this. And then these are some of the messages. This is like in a bank. I think this is a banking system where they also had to put that message. That was the message we put out: no smoking. And then on this other side, these are young people who are actually showing the different dangers of tobacco use. And this was this is in the local language. We needed to write these messages both in English but also in the local language that could be easily understood. And this is a roadside poster showing, this tag here, the pin that we had made, the pin that no smoking, or Kampala smoke free, and then the messages. The messages are there were showing the fact that you can get like you can lose your pregnancy because of smoking, and so on. The messages. These are some of the activities that we did. We had roundabout activation round activities. And in here, we lined up young people having different messages showing whoever was passing, and we usually purpose to have it on like in the morning and afternoon during a bit, and that is when there's traffic jam, so cars are moving slowly, so they can easily catch the messages. And this very last one is just one of the community dialogues. We come into a community called the people who are concerned, religious leaders, community elders, shop owners, and any other person who is the teachers. We had to bring on board the teachers because of the young people and so on. So we pulled out quite a number. We had a number of those community dialogues just to inform people about tobacco and the dangers. Next slide, please. Yes, the next slide shows these are some of the activities. This particular first one is the media dialogue that we used to have. We had media, but this time we launched the Kampala Smoke-Free City project, and so there was under a lot of media coverage. But this particular one was when we went to inspect in shops, and these were the ones selling shisha. Colleagues, shisha is not a traditional product, but it was something that was coming on as for young people mainly, and so quite a number of shops we are selling this shisha, both the cans but also the product. So here we had been tipped off, like there was a shop that was selling it. It was a foreign shop. This was selling these products. And so we had to come in. This particular one is showing one of them when we were preparing to go. We go at night. Remember, most of the revelers actually choose to go in the evening, and yeah, so we were preparing ourselves. And before we go for an operation, we mobilize people, we mobilize the police, we mobilize NGOs. We worked very closely with NGOs. I want to thank them because they did quite a lot of work for us. But also these are the KCCA, these are the officers, the enforcement officers, as we're preparing them, telling them on where to go and so on. Next slide, please. So the next slide, yes, this is now, I'm just showing you just a few pictures. We managed to get into, you just enter into a restaurant, you find people smoking. We get the people, but we also get the things they're using to smoke, mainly shisha. So we impound all the pots, and initially it was the officers who were going in and carrying all these pots. But now, lately we have changed and said, let these guys, the ones who have been caught actually smoking, carry their pots, and we go with them, because remember, we also carry these people to get them into the courts of law. So they carry their pots, put them on the car, and then for them, they get into another van ready to go to the courts of law. So we also had a toll-free line, and that was a toll-free line 8080099 000. So it was an easy number. So toll-free, you just call and tell us that they are found smoking in this place, or this kind of person is breaking the law, and that kind of thing. So there was a toll-free line that we made available to the general public, and they would inform us about those that are breaching the law. And then, yeah, just to let you know, these are some of the materials that were smoking. These are prepared materials that they put onto the shisha pot as people smoke them. So we get everything, the pots are plus every other paraphernalia. And so these have been destroyed. I think we destroyed over 9,000. In fact, that's even an estimate of the numbers. Next, and yes, just again pictures to show. The next slide shows the pictures of the destruction, how we did the destruction of these pots. Initially, the government had to foot the bill. Yeah, this is one of these. This was the destruction. We lined them up. It had filled a 40-foot container. We're placing them as we're picking them from the different shops. We're putting them in a container. And then later we had to destroy them like this. So, but initially it was government which footed the bill, but then later we found it was a very expensive venture to actually destroy. So we're asking whether we catch using this, they are the ones who pay for the destruction. Colleagues, this particular slide is showing you these people here, the very first picture here. These are the people, this is myself, but these others are the members of the KCCA. These are the mayors, the different mayors. KCCA has 5 divisions, and each division has a mayor. So there's a deputy mayor. And this lady here was the minister for Kampala. So on this day when we were destroying these products, we came together as both the political and the technical arm to just show the world what we had found and what we're doing to keep Kampala smoke-free. This is the same thing. We used a lot of, this was the police commander then, Kampala Metropolitan Region. And so it was, we made it into a glamorous occasion to destroy, or for the whole world to see how we had destroyed these shisha pots, just to make the point about no smoking in no smoking in public places in the Kampala city. For the challenges, I didn't write a slide on challenges, but I could just go them. I would just mention a few things. It was a very capital intensive program. So the funds, we found that the funds were not readily available to do everything that we had wanted to do. We ran short of funds, but somehow we kickstarted off the whole process. The other thing was we had a lot of interference. Yes, the mayors and the deputy mayors were there for us, but there are other political leaders who, when you get someone that they know, they would call you and threaten you and say, why don't you let my person go, or that kind of thing, or they would keep calling. But luckily, one of the strategies we used was to use the minister, who would say that if you want to have anyone released before they are taken to court, you have to call the minister. And I remember that time we managed to pick so many people, very high-ranking people. We found them using these products, and it was very embarrassing. So, but the minister was very strong and did not allow anyone before they went into the courts of law. So, of course, the social media currently is disturbing us, where like if you planned for an operation, the moment you go into the first spot, then they would share the messages to the rest of the areas, because of course these are rebels, they know each other. So they send, I think they even have a WhatsApp group. They would say that these guys are out here. So somehow by the time you go to the next spot, they are no longer there. And yet we do not have enough human resource to go around the whole city at the same time. So these are some of the issues. And then lastly, just to show you about the lessons learned. Just the last slide, kindly, to show you the lessons learned. The stakeholder, we had to have stakeholder engagements and participation. It helped us in achieving the compliance, but very importantly was the integration of the activities into already existing structures of government and leveraging on whatever resources were available. Then, of course, the continuous monitoring, because once you do it 1 month, people comply for some time, and then later they go back into their old style. So the continuous monitoring and supervision was very important. We found it very important. And lastly, the project was very, very important because it kick-started the implementation of the tobacco control law, and it created a lot of awareness about the dangers of tobacco use. Currently, we are no longer, the project ended, but the messages that we developed and everything, that the activities still carry the memory, and we are doing, I hope, I think we are doing better, because the recent study has found that tobacco use has reduced. We're initially at 5.8, we're now at 2.3%. So that is something that I wanted to share with you. Thank you very much for listening to me.
Thank you very much, Dr. Santongo. That's a fantastic presentation and very real lessons learned and experiences. So we can tell there's been a lot of excellent work, and also learning from trying and doing. So thank you very much for sharing all of that with us. I'm going to hand over to our final speaker, Dr. Sandra Marquez, who will be sharing experiences from Sao Paulo. So I'll hand over to you now. Thanks. If you can click into presenter mode.
Okay.
We can see your screen, but if you can click slideshow.
Yeah. Bem, é prazer estar aqui com vocês hoje. Obrigada
It's a pleasure to be here with you today. Thank you. Thank the union for the invitation through Gustavo, Sonora, and Kathy. My name, I work at the São Paulo state government. I'm the technical director at the Reference Center for Alcohol, Tobacco, and Other Drugs. And we spoke, right? We were speaking about cities and towns. And now we're going to tell you a bit about how the law was implemented in the state of São Paulo. CRATOD is a unit of São Paulo State Health Department, which was built as a reference center which formulates and implements public policies resulting from the use of psychoactive substance use. Let us not forget that tobacco use is a kind of chemical dependency, and this is important also from an assistance point of view, which Brazil works a lot with, which is caring and treating users. We are responsible also for training and managing all these units that work with the assistance network, treatment network. We also administrate the implementation of a few articles of the CQCT, Brazil, of course, is a signatory of the C of the framework signed here by former president and current president Luiz Inácio Lula da Silva in 2006, who enacted a federal law back then. The state law has existed since 2009, anti-smoking law in the state of São Paulo. We must also remember that Brazil was the second country in the world to implement the main measures for tobacco control, as well as being a signatory of the Framework Convention. Advertising, tax collection, tax increases regarding the health warnings, also implementation, enforcement, decentralization was also essential for this to exist. Some national surveys were developed, and of course, tobacco-free environments were important, which culminated in our smoke-free law, which started in the state of São Paulo. We already had a federal law, Law 9294, 1996, which already mentioned restriction on tobacco advertising. Our anti-smoking law was worked on a lot, and I find it a very important aspect, which is workers' health, which is where our country really focuses on, which is about in terms of legislation. It came up as a result of a broad discussion on the implementation of state law by the legal support of the ILO, Convention 162, and we worked a lot on passive smoking. That was essential for the implementation of this law. I think the invitation really happened to show you how we have kept this firmly, especially in Brazil as a whole, an enormous continental-sized country. And it was important to work on the awareness of the population on smoke-free environments. This is not to say that we need to increase and extend these smoke-free areas, and almost must maintain this awareness constant. Our decree was launched on the 7th of May, 2019, but it was through a project called Healthy Tobacco-Free Environment Project. It was here that we developed this whole process. I have a few examples here of the project, support to the regulation of the law. There was initially institutional interlocution, health secretariat, PROCON, which is the consumer rights entity in Brazil, Justice Secretariat, Citizens Secretariat, were all essential in order to help us to create this awareness of the population, to create dialogue with economic sectors, always the objective of regulation and society conveying the information as well. We had logistical and operational support, always counting on the support by civil society. We also counted on the prosecutor's office helping us with the inspection activities, especially when the law was initially enacted. Training for technical agents was provided, also to create awareness in them about the importance and the work to be developed. It was a public policy to be developed. For this to happen, the agents must know what they're talking about. The selection of these technical professionals was made. Stakeholders that moved around this theme. We mobilized state vigilance surveillance systems vis-a-vis health, and we developed inspection systems to see if we were really bringing about a fall in the smoking prevalence and also adherence to the anti-smoking law. We had university surveys as well, providing support to the implementation of the law, ratifying its importance. So workers' health, the workers' health law was very important from vis-a-vis the point that people became aware of second-hand passive smoking, sometimes third-hand smoking. Because people who worked in environments where others smoked ended up falling ill because of that. So a survey was run by the São Paulo University Hospital. They ran a survey that proved that carbon monoxide levels were contaminating the rooms in this work environment. So we had a lot of information about passive smokers. And this was one of the most effective measures that we carried out in terms of creating awareness, not just in the population, but also prevention, promotion for people's better health. The certification was given many ways. So we thought of we formed a committee 2 years before the implementation, which brought to light a few campaigns. We were supported by civil society, CTBR, ACT Health Promotion. This entity was a great collaborator with us and partner, helping to to promote this law. We had meetings at the Legislative House, the local council, if you will. We had manifestations during the dealings and the support for the law. Also, to certify tobacco-free environments. Posters, informative posters and folders were developed on the campaign, explaining each area where implementation would take place. So awareness was created way beforehand, and through this state committee, where we counted on government and non-government organizations, civil society, universities, we counted on their support to create this awareness before the law was enacted, so that all these people were informed that it would happen. Kratod, my entity, was the executive entity, the executive component of this policy. Health surveillance played an exceptional role also when they started to carried out the restrictions and approached the execution of the work in the many places of sale. The executive secretariat also contributed greatly when the population became bit by bit made aware, up to a point that 86% of organizations and commercial establishments adhered to the movement. We managed this through accreditation seal developed for buildings, companies, stores interested in creating a tobacco-free environment. To qualify for this seal, this certification seal for a smoke-free environment, we established 3 criteria. The bronze criterion, which would be admission to the program, you would be accredited for the program. Silver seal would when we already had a smoke-free environment and we had smoke treatment rooms, so to speak, and golden seal, which is for smoke-free environments and treatment also of workers working in these units. We also have our own website, which was important to show our control with a report channel, for denouncement. We show that there you can find our campaigns as well. We have the whole history there, the harmful effects of smoking, how inspection is carried out, constantly updated. The inspection channel is, and questions you may have to ask through and on this site. This site is on the State Health Secretariat website, and it's from the health surveillance entity. They are responsible for this. In 2019, we celebrated 10 years of the anti-smoking law. This was essential also for us to. We don't have this in English yet, this publication. This is a challenge we still have ahead of us with regard to resources, but we want to provide the whole background and history of how this was formulated, discussed, all environments. All this is within this publication if you wish to access it. And I'd also like to say that we show a fall in prevalence amongst smokers. We saw a major fall in the percentage of smoking throughout the whole country. Adherence was very good, especially in the state of São Paulo. Our federal anti-smoking law was enacted in 2014, and it brings with it many issues, and was an adaptation of our state anti-smoking law. Brazil, I still like to say that Brazil have important direct and indirect factors vis-a-vis smoking, which lead us to work longitudinally in a very important way. This is work developed by our university, mentioning the percentage of cardiovascular diseases per 100,000 inhabitants through this graph, where we see the intervals and the fall after the application and implementation of the non-smoking law. And the reports received by our 0800 number, as our colleague said before, we also have an 0800 number for reports, which show that the smoking rates started to fall. And also we see the increase in reports and the fall in reports due to so many people adhering. Almost there, Kathy, almost there. Because of passive smoking, we were made aware of how important it is to raise the awareness that tobacco is an important social commitment, because within all the psychoactive substances used, it does not carry out cognitive alterations. It's important that people minimize their addictions and its use, of course. Health communication, very important. Intersectoral work is very important. Government and non-government, political involvement also very important. We have seen that all inspection actions must have political involvement. If that does not happen, we cannot act. Number 5, promotion of participation and social control, also very important. Civil society's role in providing this support. Sustainable policies and tax policies also, which are compatible to the work. I'd like to emphasize the Collegiate Director Resolution, RDC 2019. We've had our 3rd hearing, led by Anvisa, our health surveillance entity, against e-cigarettes as well. The ratification of tobacco protection and care guidelines, These resolutions, state resolutions, were very important for this. The major challenge we still have ahead of us is the anti-smoking laws in psychiatric environments. We have made major advances due to the damage reduction policies, and we still have major challenges, which are the target of the industry to work with mentally compromised patients. Since 2019, we have implemented our anti-smoking law in parks since 2019, and we were invited by the South America, by PAHO, to an event where we will talk about cigarette consumption. We see that during COVID in Brazil, we saw 34% rise of smoking in the home. This is our final launch. Tobacco-free environments in clubs. São Paulo Football Club, founded by the British, was the first to take on board this policy, this very important policy. Thank you very much.
Wonderful. Thank you so much, Dr. Sandra Marquez, for that fantastic presentation and sharing the experiences of Sao Paulo. So I am going to ask if all of the presenters who are still with us, if you could switch on your camera so we can see you. Wonderful. And if Dr. Sentongo, if you are able to add your camera. Wonderful. Okay, so thank you very much for your presentations. I would like to first welcome Dr. Mary Liziwati, who is the head of the health office at Depok and will be able to answer the questions that we have had coming in from Depok. Thank you very much for joining us. And of course, we have Sandra and Dr. Sandra and Dr. Sentongo as well. So I would like to start with a sort of more general question first, which I will put to each of the panelists, which is really about what advice you would give to another region or another city that is trying to implement smoke-free. What would be the best advice that you would give to that jurisdiction from your experience of how to effectively implement the tobacco control law? So I will start first with Dr. Sentongo. If you are there, can you hear me?
Yes, I can hear you clearly. And yes, I think the advice I would give to any other jurisdiction that is beginning to implement is to prepare. Preparation, informing the people about it, informing, the regulated community about what they don't have to do, and so on. I think that's very, very important. And for us, we believe also that the fact that tobacco control, we cannot manage tobacco control from offices. It has to be managed at the local level, the grassroots level. So if we inform people about what we want, what the dangers of tobacco are, they're the ones who are going to catch whoever is breaking the law, and they'll be the ones to inform us. So that's the preparation is very, very, very important.
Thank you.
Yeah.
Dr. Mary Liziwati, would you like to add anything?
Okay. Sorry, I will explain in bahasa.
Please.
Ya, baik. Terima kasih.
Thank you very much. Depok City has actually been preparing the regulations about smoke-free areas. So since the law number 39 year 2019 was issued, before that, into 2012, we have started the preparations, as Dr. Hafsa mentioned. We have created studies and surveys to the public whether or not the public really wants this smoke-free area. And at that time, the result of the survey in Depok area, more than 70% of the people there wanted a smoke-free area. And then we performed studies, and until 2014, we can issue the regional regulations about smoke-free area. So this has been a commitment from our leaders, provincial leaders, and supported by the public there. In terms of implementation, it's very hard. It needs support from many parties. So we, the health office of Depok City, together with the government tools of the Depok City and together with the municipal police, we keep on doing inspections to the areas, many areas who are selling cigarettes so that we can increase our compliance. I think that is all. Thank you.
Thank you very much, Dr. Mary. Very helpful addition there. And Sandra, did you want to add anything else that the other speakers haven't said?
Eu acho que implementar
Well,
uma
I
lei
think that
desse
to
tipo tem que se
implement a
manter
law
também
of this
também, né, Cat?
type and that
Exatamente, porque
maintains
a
itself for
gente faz
such a
planejamento.
long time, right,
Planejamento
Kathy?
é fundamental que a
It's
gente
about
tenha
planning.
aplicação e
Planning is
implementação da
essential
lei com
for us to
sucesso.
communicate and
Eu acho que o
implement the law
planejamento foi
successfully.
executado,
I think
apesar dos desafios,
planning was,
muitas das pessoas,
it was
mais de
planned and
80% da
executed in
pesquisa
spite
queriam
of
um
the
ambiente livre de
challenge.
tabaco antes da
Oh,
implementação
over
da lei,
80% of
regulamento. É
people in the
específica
surveys showed that they wanted
adequadamente,
the law implemented. We also
mas
carried out
ninguém,
surveys
e
here
sem muita
about the subject.
sensibilização, sem dar
But we
condição
must understand
adequada,
that without
sem
awareness, without the
tratar
adequate
desses
conditions,
usuários,
without
sem oferecer
treating
ajuda,
users, without
isso
offering
também foi uma
help,
organização
that
conjunta,
was
um
also
trabalho
jointly
importante
organized,
de fiscalização,
important
mas também de
intersectorial
apoio a
work
esse usuário.
vis-a-vis
Então, a
fiscalization,
operação
inspection, but
rede
also
de tratamento
support
também foi
by the
fundamental para que isso
treatment
ocorresse,
network.
uma vez que o
This was
tabagismo
essential
é
for
uma
this to
forma de
happen as well,
dependência
since
química, causa
tobacco
sofrimento
smoking is
físico
a
e
kind of
mental,
physical
e
dependency.
às vezes a
It causes
gente
physical and mental
quer
suffering,
ter uma questão mais
and
ostensiva
we
do ponto
want
de vista
to be more
político, né? Mas a
ostensive
gente
or
também tem
work
que
more
pensar no
ostensively from
cuidado,
a
e
political
isso foi
point of view.
fundamental
We
também
also
para
have
que
to,
as pessoas aderissem
be careful with
aos,
regard to
aos
care.
programas.
They have to pay attention to this. That's why we were so careful about choosing our programs.
Thank you. Thanks, Sandra. And an excellent reminder, of course, of putting smokers as a key stakeholder within our planning and supporting them as well. Thank you. So my next question I was going to ask, we've had a few mentions of the Framework Convention of Tobacco Control, which I know that Indonesia has not ratified. But I wondered if Sandra, could you talk a little bit about if that has had any, if you've been able to use the Framework Convention to support, or if it's played a role in enforcement and implementation of the law?
Claro, fundamental.
Oh, definitely, definitely. It was essential, actually, because
Nos deu subsídio, né?
the
Cabe
article
ressaltar que
gave us great
a
support, great
Convenção Quadro é
subsidy.
documento que
The
norteia
Framework
a nossa
Convention is
política
a
nacional
document
de
that
controle do
guides our
tabagismo.
national
E
tobacco
o
control
Brasil,
policy.
assim como eu falei
And
anteriormente,
Brazil,
foi o
as I
segundo
said
país
before,
que conseguiu
was the second
implementar
country in the
as
world that was
medidas
able to
ambientais,
implement
mais importantes.
the
E sem contar que também
measures,
a gente
which
foi,
are very
essa acho que é a
important, that
mais
need
importante,
power.
Cat, que acho que eu
I
vejo
think,
muito
Kathy, it's very
às vezes eu vou em
important.
alguns congressos em outros
I go to a few
lugares, a
congresses,
gente tem medicamento
elsewhere.
gratuito em todo
We
o
have
território
free
nacional.
medication
Então, quem quer parar de
all over
fumar no Rio Grande do Sul,
Brazil. So if you want to stop smoking in Brazil, go to the Brazilian NHS, the Brazilian National Health System, SUS, SUS, to seek treatment with the cognitive behavioral approach and also treatment to, to reduce use. This was very important intersectorial work, liaising with the health ministry. The health minister is the president of the National Committee for the implementation of the Framework Convention, and at INCA, the National Cancer Institute, also their leader there was also helpful in terms of joining and contributing towards the policy in all territories throughout the country.
Thank you, Sandra. I'm going to switch to a different topic.
I wanted to say
please,
something.
Please, Dr. Sandonga, please add. Yes, over to you.
Yeah. Yes, I just wanted to say something that in our situation in Uganda, vis-a-vis the FCTC, there are certain things we did a little more than the FCTC, and somehow the industry was coming out to challenge us, saying that we are doing more than what the FCTC was providing. For instance, for the pictorial health warnings, there's somewhere where they talk to 50% of the display area and so on. But then we had to pull out. Of course, it's again protective. We had to pull out the fact that it says that whatever is being provided for in the FCTC is a minimum, and countries that were actually advised to do better. I mean, to put it even better where possible. So I just wanted to bring this in, that when sometimes we went a little ahead and then were challenged by the industry, but of course we managed to explain to them as well. But yes, the FCTC has some usefulness it did also as to the implementation.
Thank you. Thank you. That's a very useful point. And I think we've seen this in many different jurisdictions where the industry comes after the regulations and uses different arguments. This is one example. And I know that DEPOC has also faced, despite not relating to the FCTC, the DEPOC has faced legal challenges also. But I wanted to ask Dr. Mary, there was a question specific to DEPOC, which was around the use of or working with religious groups and religious arguments. And I wanted to ask if you had any, if that was the case in DEPOC, if there was any engagement with religious groups, and did that support the implementation of smoke-free?
Ya, baik. Ya, terkait dengan kawasan tanpa rokok.
Okay, about free smoke areas in Depok, we actually more use health arguments. As mentioned before, Indonesia is majority has Muslim citizens, but about this smoke-free area, we use health arguments rather than religious.
Thank you. And Sandra, I believe you also used the secondhand smoke health arguments in implementation. Perhaps you could say a little bit more about how you used that evidence.
Os cuidados em saúde mental, inclusive, acho que
mental health also, mental health care also as well. These are being well disseminated at the moment, especially vis-a-vis maintenance. Don't forget, nicotine has always been connected to mental problems, and this was used by the industry as a way to implement this as a, human testing In California, we've seen this, San Francisco, with the opening up of industrial documents. This allows us to say that this product, nicotine, was produced to work mainly, act on people's mental health. So you have all the tools at your disposal. You have a population whose mental health is problems are growing, and now we have e-cigarettes, the shishas, other nicotine conveying products. We have to really think well when we talk about a general comprehensive tobacco control policy. We talk a lot about cigarettes, we've talked a lot about the end game, but we do have to find these new products as a renormalization of the act of smoking, and a kind of a quota element, so to speak. When we talk about passive smoking, we also have passive vaping. There have been studies on this as well. Over 2,000 substances are in e-cigarettes. So when we talk about passive smoking, not just for humans, but when we talk about One Health, the environment, we talk about the animals, we also contaminate animals. Here in Sao Paulo, we recently involved, other agents in this approach, which are vets, the veterinary doctors, who have brought up the awareness of smoking on our pets, our animals, vectors also for other diseases. We have to look at the One Health issue, which also has, I think, to be added to tobacco control policies.
Thank you. Thank you, Sandra, for sharing all those different important messages and stakeholder engagement. I wanted to pivot to Dr. Santongo to ask specifically about engaging leadership. So you shared some good examples of the mayors of the different parts of Kampala being involved in the tobacco control enforcement work. And I wondered if you could speak a little bit about your experience in engaging leadership in the city for enforcement work. Thank you. Dr. Santongo, can you hear me? Oh, sorry.
Yes, Dr. Kathy, I've missed a certain part of you. Sorry, I missed a certain part of the question. I think it's my network this side. I couldn't hear clearly.
I was
you were asking about the yes.
Engagement of city leadership in enforcement, your experiences.
Yes. You see, it was project mode. I think that was one of the things. It was project mode. So everyone really, many times people want to participate in projects. But that said, however, we trained them and we asked them to make commitments. And so it was something that they, I think they wanted, they really, but they wanted to fulfill their commitments towards the electorate. And we engaged them in the training of people, like those community dialogues. They would go and also have explanations to the people. So it was two-way. Being politicians, they are listened to, but also the fact that they were the ones giving information, it was very easy to have them on our side because they always felt that they needed to commit to the statements that they were making. So it was two-way for us. And yes, the politicians are different. We had different politicians on different sides. There were those that were pro, but there were those that were not so much. For instance, I've told you about the ones that did not find it well for their people to be to be taken to court or to sleep in a prison cell because of breaking a tobacco-related offense, committing a tobacco-related offense. So yes, the politicians were there, we worked with them, but they can be very slippery, I don't say that, but yeah, for lack of a better word, but they can change many times. But the ones that are in very prominent positions, it can be very difficult. The moment they commit, it's very difficult for them to change. But these other ones at the lower level, anything can be.
Thank you. Thank you very much.
So over to you, Kathy.
Dr. Mary, did you want to add anything about the role of leadership in enforcement? Thank you.
Ya, baik.
We in the city of Depok, the mayor and the vice mayor, they would be our role models. They are not smokers, and they always remind all of the officials in the city of Depok or the citizens of Depok to adhere to the regulations, especially the prohibition of smoking in the smoke-free area. So they are set of good example, role models. The mayor and the vice mayors, both of them are not smokers, and they always try to remind everyone to not smoking in the smoke-free area. Because as we know, most of the people in Indonesia still smoke, but we are constantly disseminate information about this regulation, and gradually the public would adhere and follow what we have set in the bylaw. Thank you.
Thank you very much, Dr. Mary. I can see that we're almost out of time. So I'm going to just give a very brief summary, and then I'm going to hand over to my colleague Lindsay to give us a final, very quick demonstration of our website support before we close out. So I think we heard some incredible experiences and lessons learned from the different cities and states today. I certainly heard a clear message about the importance of leadership and the importance of engaging leaders in their role, as well as planning. I heard that from everyone, planning and planning and planning. That raising public awareness is very important, and communicating the why, having good evidence to show why this law is important, and then communicating that effectively, using that evidence and ensuring people understand their responsibilities, but also taking action, decisive action to monitor, enforce, and sanction, and ensure that violations are not allowed to stay in places. Similarly, targeting the industry and making sure that the industry is not influencing enforcement or successful in tackling the law. So being constantly vigilant against the industry, and then also celebrating success, making sure that we tell those stories and keep raising public awareness, and of course to help smokers. So any implementation or enforcement of the law should also incorporate support for smokers. So many great lessons and experiences there. I'm going to say a huge thank you to our speakers, to Dr. Sandra Marquez, to Dr. Hafsa Sintongo, to Mr. Imam Hartono, and of course our panelist, Dr. Mary Liziwati. I'm going to hand over, Lindsay, to you now, just for a couple of minutes for a quick preview of our implementation hub, and then we'll close after that. So over to you, Lindsay.
Fantastic. Thank you, Kathy. So I'm sharing my screen right now. Hopefully you can see it. I'm going to go through this pretty quickly, just the last few minutes of our webinar. We wanted to share the Global Implementation Hub, which is a key resource that the union developed in 2021 to support governments and public health practitioners to improve implementation and enforcement of tobacco control laws, and ultimately improve compliance and protect people from the harms of tobacco. And so you can navigate through the hub using the menu at the top, so you can learn more about the hub, kind of what implementation is, more about our program, the Global Implementation Program. You can also contact us and find experts from around the world who focus on different implementation areas and needs. You can also visit our implementation areas. So from today's webinar, perhaps you're really interested in learning more about enforcement. You can explore the enforcement actions page, where you can find guidelines and resources and strategies that can help support your enforcement efforts. You can also explore different policy areas such as smoke-free, TAPs, and tobacco vendor licensing. And you can also explore more about what we do in country with the countries we support. We will be expanding these pages at the end of the year and into next year, so stay tuned for country-specific resources and resources that are available in specific languages that are relevant to those countries. And then finally, in just the last couple minutes of this webinar, I really want to share the resource library. The resource library is really one of the key features of the hub. I won't scroll through everything, but as you can see, there's many, many resources in the library, and you can filter down and navigate through by selecting different filters on the left. So again, from today's webinar, perhaps you're really interested in just enforcement resources. You can select that filter and the library will pull up everything related to that. And perhaps you want to refine even further, you can go into the search bar and you can type out TAPs and hit search, and it'll pull up everything related to enforcement and TAPs. And so that's really it. Very fast, but we really encourage you to visit the hub and explore the resources available to you to support your implementation efforts. You can get in touch with us if there's anything specific you need assistance on, or if there are any resources you would like to see available in the hub. And so with that, that's it. I will stop sharing my screen, and we've reached the end of our webinar. Kathy, I'll pass back to you for a final word.
Thank you so much. Please do visit the hub. If there are missing resources, please send them our way and let us know any feedback you have. Please do share it with your networks. There's so much useful content and resources in there. We all want to work together to support improved compliance with laws across the globe. We will be doing starting more webinars next year, so please keep an eye out on our hub for more examples and case studies and lessons learned. We just want to say a final thank you to our speakers again for your excellent contributions. We will be sharing the presentations and the link to the recording afterwards with everyone who's attended. So if you missed any of it, you'll be able to see it after the event. So with that, I will just wish you a good day or a good night, and thank you again. Best wishes. Bye.
Thank you.